Hello everybody, myself Dr. Vandana Narula, Senior IVF Consultant at Motherhood IVF Center, Chandigarh. Today I will be talking about a very common test or very common examination which we do in our OPD, and many patients fear this examination or are afraid of getting this examination done and have never even undergone this examination before they reach us for assisted reproductive technique, and that is a simple per speculum examination. What is a per speculum examination? In this per speculum examination, we introduce a small speculum inside the vagina and visualize the cervix. Visualize the vaginal walls and also the mouth of the uterus, that is the cervix. That is, the cervix or the mouth of the uterus is a very important organ of the female reproductive system, and it is very important for us to see its condition before we start off with any kind of infertility treatment. Normally what is done in the first visit is that the patient comes to us, a per speculum examination is done, a speculum is introduced into the vagina, which is a very safe procedure that is quite painless, and a pap smear is taken. Now pap smear, if you haven't undergone a pap smear in the recent past, then it is a very good opportunity when you come to us to get it done before starting off with any procedure. Now if your cervix is normal looking and there is a good cervical mucus, then there are very good chances that the good cervical mucus will help the good sperm to swim over and reach the fallopian tubes. On the other hand, when the cervix is bruised, that is, there is erosion, there is cervicitis, there is infection, or there is some discharge on the cervix, then it might be possible that during the natural intercourse, these sperms do not get chance to swim up the uterus and reach the fallopian tubes. The normal sperms might have died inside that infectious discharge that is present in the unhealthy cervix. So once we do a per speculum examination and take a pap smear, and we can diagnose the discharge or the cause of the discharge that patient is facing, and a treatment can be given, and many patients find this very helpful for their normal natural intercourse also, because when a patient has cervicitis or when the patient has a problem of a chronic discharge per vaginum or dyspareunia, that is pain during intercourse, it affects the quality of sexual life, and in turn it also affects the fertility of the patient. So I would say that do not hesitate to get the per speculum examination whenever the doctor asks you, because when we see you, we examine you, we do a per speculum examination, then we do a transvaginal examination, we might also do some blood tests and a tubal patency test before we start on your journey to fertility, before we decide upon what plan of action or what plan of treatment is good for you for achieving a positive pregnancy. Thank you.